Well, thank you very much. I'm Dr. Kevin Kavanagh from HealthWatch USA, and I would like to talk to you today about enhanced barrier precautions and concerns that we have regarding implementation of this strategy. Now, the spread of multi-drug resistant organisms is of utmost concern in healthcare facilities, and for decades, contact precautions have been used to prevent this spread. This includes staff using gloves and gowns and placing patients infected with or colonized with MDROs into isolation. Recently, the CDC has proposed a watered-down version of contact precautions, which they call Enhanced Barrier Precautions, and we have a number of concerns with this strategy. Now, this strategy is recommended for healthcare facilities that have residents in congregate settings. This includes nursing homes, skilled nursing facilities, and also behavioral health units, such as in acute care hospitals. One of the major concerns is that residents with many types of MDROs are not restricted in their activities. They can wander around a facility, and contact precautions are not universally recommended for these residents. Enhanced barrier precautions only recommend that staff use glove and gowns during high contact or high risk encounters with patients, such as performing personal hygiene, bathing, toileting, medical device care. They're not recommended for low risk activities, and we have to put that in quotation marks, such as passing meds. And we'll discuss later on there really is no low risk activity. Now, enhanced barrier precautions are specifically targeted at nursing facilities, including skilled nursing home facilities, and they're looking at specific types of MDROs. They're not for residents which have diarrhea or draining wounds, or if they have other sites that are secreting or have excretions of these organisms. Because of this, enhanced barrier precautions are not recommended for C. difficile or for norovirus. They are, however, intended to provide facilities with the flexibility to implement these precautions for residents colonized or infected with epidemiologically important MDROs, including MRSA. And here's a list of some of the organisms these precautions cover. This includes CRE, which is the dangerous nightmare bacteria, Candida auris, MRSA, multi-drug resistant Pseudomonas, multi-drug resistant streptococcal pneumonia. Now, Candida auris has been in the news lately. As you probably are well aware of, it spreads in healthcare facilities, and it is an extremely dangerous organism. The CDC has stated that 1 in 3 patients that have invasive Candida auris will die, and it's of utmost importance to get this organism under control and to stop its spread. It's described as spreading quickly and causing infections in dozens of countries. And it's becoming very drug resistant and hard to treat. The lay press has had a number of articles which have reported on outbreaks and the danger of outbreaks of Candida auris. The CDC has a map which shows these outbreaks, similar to the maps they have of COVID-19. There's been a recent outbreak at the University of Kentucky Medical Center, and that just occurred last month. And again, this is making headlines. So at the same time, the CDC is concerned about dangerous outbreaks. They're letting patients in nursing homes roam around the facilities with Candida auris. Now, MRSA, or methicillin-resistant Staph aureus, is another significant problem. There have been at least 2 studies which the CDC has at least used initially to justify enhanced barrier precautions. But if you look at the data in these studies, they really don't support enhanced barrier precaution usage. So currently, the CDC is recommending enhanced barrier precautions based upon expert opinion. And that's unfortunate because their original data did not support usage. And we'll go through this. And I will explain this. In nursing homes, there have been at least 2 studies that have shown that the rate of colonization of residents with MRSA approaches 30%. And if you look at enhanced barrier precautions and the chance of spread to gowns with different healthcare worker-patient interactions, these are all too common. For example, one of the low-risk activities is passing of meds. There's an 8% chance of contamination of gowns. Well, let's do the math. If almost 30% of the residents have MRSA colonization, and a healthcare worker passes meds to residents 3 times a day, 7 days a week, and there's an 8% chance of transmission, this would equate to over 11 transfers of MRSA to the clothes of a non-gowned healthcare worker each week. Again, this makes no sense not to put on gloves and gowns when you are taking care of a patient that is colonized with MRSA. And the same calculation is true for gram-negative bacteria. For example, Blanco et al. Estimated that the colonization of residents with gram-negative bacteria is over 20%, and that there'd be overall an 11% transmission with each interaction. If one looks at the passing of meds and contamination of gowns, the odds ratio of this happening was 0.3, which means that there was a 3.3% chance of transmission with each interaction. This would equate to a 69% chance of transmission each week for every colonized patient that healthcare worker is taking care of. So the underlying problem with enhanced barrier precautions is that even low-risk interactions occur so frequently that transmission can occur. And this is on top of the problem that these residents are allowed to roam around a facility. So I outlined my concern in a number of public comments. The first one was in November of 2019, where I outlined the problem of enhanced barrier precautions and had even pointed out that the CDC in their threat assessment presentation stated that Candida auris and CRE needs to be contained through an aggressive approach. Well, that certainly isn't enhanced barrier precautions for nursing homes. And this laxity in infection control in nursing homes set the stage for the spread of COVID-19 in nursing homes, which was the primary factor that we developed an uncontrolled outbreak in the United States. We did not contain SARS-CoV-2 in the United States, as, for example, SARS-CoV-1 was contained in Canada, because the organism spread rampantly throughout nursing homes because of lack of effective infection control practices. In June of 2023, I again stressed the problems of enhanced barrier precautions and again restated that the better alternative would be to identify a patient's microbiome, to decolonize patients who were carriers, and if decolonization wasn't successful, to cohort these patients with other individuals that had compatible microbiomes. And finally, on November 2nd, I stated that with enhanced barrier precautions, the CDC is allowing those with Candida auris to wander around facilities, and at the same time, the CDC is warning about dangerous outbreaks of Candida auris. It makes absolutely no sense, and I feel enhanced barrier precautions are a very dangerous strategy, which is being advocated by the CDC. Thank you.